Hello, everyone. I'm Solomay Tibabu, the host of Going Digital Behavioral Health Tech. We've got a great session today with Alex from Two Chairs. Before we get started, Alex, could you just give us some background on yourself, a brief introduction?
Yeah, that'd be great. Thanks so much for having me, Salome. My name's Alex Katz. I'm the founder and CEO of Two Chairs. My background is a mix of healthcare and technology. And what brought me to this work really was a personal connection. It came from seeing close friends and family members struggle in different ways and ultimately really struggle to get help.
Thanks so much. And then you eventually started Two Chairs. Tell us more.
Yeah. For me, it was a real journey. It started with seeing my partner struggle through a search for a therapist that unfolded over many months and ultimately led her to work with the wrong therapist for her. And that was kind of the initial insight for me as someone at the time who was new to this space, seeing that therapy is not a commodity. You look out at the broader mental health care system. There are, a dozen different provider types. There are hundreds of different therapeutic interventions. And I learned that from the research literature, we know that the therapeutic alliance between a client and a therapist is everything. It's literally the best predictor of outcomes in care. And that was kind of the insight that led me to start Two Chairs. We're an outpatient mental health care system today focused on the West Coast of the United States, with matching really at the heart of what we do, using a ton of data and nuance to get our clients to exactly the right place with exactly the right therapist for them.
Well, this is a big issue. I mean, speaking from personal experience, I had to see 4 different therapists as an adolescent and then a young adult before I could finally find somebody who could explain to me, oh, actually what you have is something called obsessive compulsive disorder. Had no idea, and obviously was life-changing. And so would love to ask you, it sounds like matching is a big piece of what makes Two Chairs different. What are you doing to end bad dates with therapists?
Yeah, it's a great question. The experience that you just described, Salome, it's a very common experience. We hear that story countless times from our clients, from our friends, our family members. And what you just described is often thought of as the gold standard in this country for finding the right care for you. The gold standard is seeing a handful of therapists, having a first couple of sessions with them, testing out if it's right, and then moving forward with the therapist who's the best fit. That sounds all well and good, but you have to put yourself in the shoes of a person who has never sought out mental health care before, maybe has stigma attached to that decision, someone who's in the midst of a depressive episode, someone who has had a panic attack for the first time in their life. These are really challenging moments in folks' lives. And our mental health care system is asking them to build a process where they're going to go shop around and have a bunch of dates with therapists where they're talking about things that they've maybe never talked about with anyone in their entire life before, and then having to repeat that story over and over again. It's kind of no surprise that the modal outcome in the mental health system is folks going to a therapist once and then never coming back. And what we hear time and again is people saying things like, therapy's not right for someone like me, which is heartbreaking because therapy is right for everyone. It literally could help anyone. But what's happened is folks, by random chance, have ended up with the wrong therapist. That happens all the time because of that diversity in the field that I talked about. The way that we've thought about matching at Two Chairs philosophically is let's take the onus off of a client who probably doesn't know all that much about therapy, probably doesn't even understand their own preferences when it comes to therapy. This is not a typical consumer good. If you're out shopping for shoes, you know what you want. When you're out shopping for a therapist, you may not. And so our process emphasizes gathering a lot of information from a client, both virtually, but then actually with a 45-minute matching appointment that one of our licensed therapists leads, where we're getting into an immense amount of nuance and color about who this person is and what they really need and would benefit from in care. And what we find is that actually the digital questionnaire gets us the basics, but it's not all that predictive of what that person needs. We're getting a lot of the signal, a lot of the real data from that room where an expert clinician with deep intuition about humans is conducting that interview and going into that depth. And from there, that matching therapist puts a lot of that clinical conceptualization of the case into our software, and an algorithm takes over from there and is considering hundreds of different data points and making really precise matches for every client that comes through our door. So in effect, we as the system, we have the expertise, we have the data, we have the clinicians, we're doing the heavy lifting of getting folks to exactly the right place for them. So in effect, there's no dating. We're just getting you to the right therapist for you, and it sticks. 99% of our clients say that they were matched with the right therapist for them. And that means it's actually extraordinarily rare that someone has to go on a second date.
And the second date in this situation, that's not insignificant. Stumbling out of the starting blocks rather is exhausting. And, I've experienced that personally. Ironically, I met my boyfriend, a psychologist, through a dating app, but perhaps that's a different show. Now, you've mentioned technology a couple times. From what you've shared, it sounds like tech plays a pretty big role in how Two Chairs is able to match clients to therapists at scale. Would you say the matching algorithm is your secret sauce then?
Yeah, it's a really good question. I think when it comes to matching at Two Chairs, technology plays a really critical role. And we're big believers in the power of technology. But I think philosophically, the way we approach using tech in mental health care is really, how does tech enable clinicians that bring the expertise and the human intuition that is so critical to making this field work? And I think approaches that have tried to use technology in place of therapists, taking the therapist out of therapy, those are approaches that have largely failed. And so when it comes to matching, there's a big fancy algorithm that we've built that is crunching a lot of numbers and is very sophisticated at sifting through all the data we're getting from a client, from a matching therapist, what we know about our clinical team, availability data, et cetera. But that algorithm, in a sense, is pretty dumb. That algorithm actually knows very little about human psychology and what makes humans tick. That is coming from that matching therapist who's in the room for 45 minutes with a client and asking all of those follow-up questions, getting into the nuance, like I said. So the algorithm is really only as good as the signal being provided by that clinician. So the way I would frame the, quote, secret sauce of matching at Two Chairs is it's a really elegant blend of the best of expert human clinicians with the best of technology and data.
Excellent. And also, now you mentioned data. If I could ask you, so I know you collect a lot of data on outcomes in particular for your clients. Does that play a role in how you match as well?
Yeah, it's a really good question. We're big believers in the role of data in the mental health care system and in measurement-based care. The way that we've approached this is collecting data from our clients before every single session. We're checking in with our clients about the clinical alliance between them and their therapist. We're checking in about symptoms. We're checking in about their overall experience at Two Chairs. And that data collection is really critical. About 90% of the time, we're getting that data from a client. So we have an enormous amount of rich longitudinal data about our clients. Part of what that enables is closing the feedback loop with matching. We've made a match based on, a set of data and signals that we're getting from a digital questionnaire and a matching therapist. But then immediately after that first session, we can look at alliance data, look at symptom data, and start to assess, have we made the right match? And then obviously look at data throughout the course of care. And over the last 5 years, that algorithm that we're using to match has evolved considerably as we've built a larger data asset and gotten smarter and smarter about what is truly most predictive of outcomes in care. It turns out to be a really nuanced, complicated question because humans are unique. They're presenting with lots of different types of conditions from lots of different identity backgrounds, many different preferences. And so it's taken years of building out that data asset to really, truly understand how to make matches for lots of different types of folks. The other thing that measurement enables is better care week over week. And what we know from the research literature is measurement-based care can make a profound difference over, someone's care journey. What doesn't really matter is collecting data, and that data sitting in a database. That actually has very little impact on care. What we know from research is we see impact from a clinician taking that data and using it to inform clinical decision-making, and ultimately to engage the client in the room with that data. That's something that happens exceedingly rarely in the mental health care system. The vast majority of therapists get no training in measurement-based care in grad school and their training programs. And so for us, MBC is certainly about technology. It's about a really easy user interface that enables clients to give us data, enables clinicians to visualize that data. But equally importantly, it's about building the right team, investing in training and management that ensures that that data is being brought into the room and is driving outcomes.
Thanks so much for outlining that. Of course, measurement has become ever more important, and I'm really excited to hear how you're approaching it. So we've talked about all the data that you collect from clients to be able to match them with the right therapist, but you also have to have the right therapist to match them with. So how are you able to make sure you have the best therapist for every client?
Yeah, it's a really good question. And I want to speak a little bit first to kind of how we've approached building that team, and then a little bit to how we've thought about clinician experience. The team that we've built at Two Chairs, I think the thing I would emphasize more than anything is it is a profoundly diverse team. Given we care so much about matching, we need a diverse team. You can only make nuanced matches insofar as you have a diverse team that covers all the different areas our team covers. To summarize, we've got a team that has 90 plus areas of clinical expertise. It's a team that's more than 45% BIPOC. It's a team that uses more than 32 different therapeutic interventions in the room. And we need that because we've got a diverse client base. In fact, more than half of our clients today that see Two Chairs for mental health care, more than half are BIPOC or come from other underrepresented groups. And so we've got to have a team that is that diverse to show up in the right ways with their clients. And then when it comes to clinician experience, I think what we have found is, look, the mental health care system doesn't work very well for clients. It also doesn't work very well for therapists. And what we see out in the field is rates of burnout that are exceptionally high. Therapists often don't really like the settings they're working in. They're not working with clients that are well matched to them. They have a lot of paperwork and bureaucratic BS they have to put up with. They don't feel invested in, they don't feel supported. And so for us, the way that we have built Two Chairs is by centering both clients and therapists in the way that we kind of build our system. And for therapists, what that means, first and foremost, is having the right clients for them. This is something that is never talked about in mental health care, but therapists have preferences too. There's almost this dogma that a therapist should be able to treat anyone who walks in their door. And that's certainly how they're trained, and that's fantastic. But therapists have preferences. They like to develop their skills in certain areas. They like to see folks from different identity groups. And part of what's so unique about Two Chairs is we take all of those preferences into account. So in the same way that a client is filling out a detailed digital questionnaire about what they need, what they're looking for, our therapists are doing exactly the same thing. And they can talk about where they have expertise, the types of clients they prefer to treat. And that all gets reflected in that matching process that I described. The result is a panel of clients that is well suited to a clinician's expertise and preferences. And that makes the work dramatically more fulfilling. They're more engaged with the work feels more sustainable. And that's a big part of what's unique about working at Two Chairs for a therapist. The last thing that I'll mention in terms of our clinician experience is really from the beginning of founding the company, we have focused on employing therapists full-time and really thinking about our offering not as a gig, not as a place to collect a few clinical hours, this is a career. We want therapists to come to Two Chairs and spend many, many years here. And to pull that off, we have to invest in them deeply. We have to think about their career path. We have to think about their professional growth and development. We have to invest in managers who have teams that they're building community with, supporting, et cetera. So those are some of the things that we're really focused on when it comes to clinician experience, although we think there's a lot more work to be done here.
You've brought up some really great points. And if I could ask you a follow-up that's in that same vein. So, of course, the shortage of mental health workers is something that has been top of mind for many companies. How is Two Chairs able to attract great talent and really grow the supply of clinicians?
Yeah, it's a great question. I think the shortage of mental health providers in this country is talked about a lot, and I think for good reason. The first thing that I want to say on this kind of shortage is, well, I think it's true. I think it's overrated. I think it's overrated in that the mental health system in this country does not do a very good job of efficiently using the unique talents that our therapists have. Because we as a system aren't doing much matching, it means that clients are randomly ending up with therapists that are probably not well suited to the needs and the preferences of those clients. And that means we're wasting a lot of time. We're wasting a lot of capacity and sessions on bad matches, on shopping and dating therapists, on care that isn't very effective. So I think our first kind of response to how do you address that shortage is let's really efficiently use therapists' unique abilities and talents. The second thing is exactly what you're talking about, which is how do we attract and retain some of the best therapists in the markets we serve. We've had a lot of success with doing that over the last several years. It's a team that we've grown dramatically quickly. I spoke already to the power of matching, not only for clients, but also for therapists. I think a second thing for us that's really resonated is that investment in professional development. Something we hear from therapists time and again is therapists are lifelong learners. They don't want to just study therapy in grad school and then just do the same thing for the next 30 or 40 years. They want to continue to hone their craft. They want to learn new therapeutic interventions. They want to learn how to work with new types of clients. They want to learn from peers that maybe practice in different ways, conceptualize cases in different ways. And over the last couple of years, that has been a huge focus for us. Creating a professional development speaker series where we're bringing in amazing thought leaders from the field. Creating specialty consultation groups where folks can be with other therapists that are looking to learn or specialize in similar areas. And then investing in managers. I think the prevailing dogma in the field is often once you're licensed, you're a fully formed clinician, you don't need any more support. We don't agree with that. A fully licensed clinician is an expert. They know what they're doing. They're very, very capable, but they would still benefit from a manager who's invested in them and is working with them to craft a growth plan, is thinking about their professional development, is seeking out opportunities across the organization for them in particular. And that's why we've kept that management ratio between a clinical director and a therapist pretty focused. A typical CD at Two Chairs has 10 folks on their team, which enables them to devote a lot of time and energy and care to every single individual, building community, investing in their growth, and making sure folks feel really supported. Because the thing that I'll emphasize is the work of a therapist is challenging. It's emotionally draining, and giving them the support they need is absolutely everything. And that's why we're focused in the areas we are.
That's so important. And especially now when, we're talking about burnout all the time and companies are just scrambling to figure out their role in supporting employees. But clearly Two Chairs has been a leader in this for quite some time now already, which is really great. So, of course, I have to address something that hasn't come up yet. I noticed that Two Chairs isn't just a teletherapy provider, but you also have brick and mortar clinics across the West Coast. Which is something that most mental health companies don't seem to be investing in as much lately. Why are you prioritizing this?
Yeah, it's a great question, Salome, and it's a timely one. COVID has had a profound impact on how the healthcare system works in this country, and in particular, how mental health care works. Prior to COVID, Two Chairs was predominantly an in-person therapy business. Almost all of our visits were in person because that's what our clients and our clinicians wanted. That was their strong preference. What we have found over the last couple of years is preferences have certainly evolved. We have a lot more clients that are open to or even prefer virtual care. Virtual care is convenient. You can fit it into your schedule, and it can be really, really effective. At the same time, we're finding a lot of our clients are either sitting on the sidelines and they're waiting to come to care when they can do it in person, or they prefer in person and they can't wait to get back to our clinics. And so that's part of why we're so focused on hybrid. The way that I would frame this is clients across the country have diverse preferences. Some want to come in person, some want care virtually, some want a mix of the two. And so, given that we are trying to build the most client-centered mental health care system, it feels pretty obvious to us that we've got to build a hybrid system. It's the only way to provide care in a truly client-centered way, providing care on the terms that our clients want to receive it and engage with it. And it's something we hear time and again from clients and from payer partners. Hybrid is the future of mental health care. It's the way that folks want to engage in care. And it's a really big part of our identity. So for us, it's about having both that seamless virtual experience, but also having beautiful clinics. The design of our clinics has been a big focus for us since we opened the very first one. We've thought a lot about the furnishings, the art, the plants, what that entry experience feels like. Therapy for too long has existed down a long, dark corridor, which I think just adds to the stigma. It adds to the perception problem we have with this field. And so by elevating the space in which therapy is occurring, we believe we're fighting stigma and we're creating space that feels inclusive, that feels warm and welcoming. And what we've heard from our clients is they want to come back and engage with care at Two Chairs, one, because of the great match, and two, because of a really seamless modern experience, either in a beautiful physical space or, virtually.
All you had to say is long, dark corridor, and that's not the vibe.
Yeah, it brings you right back. I feel like we've all walked down that long, dark corridor, right?
Yes. Right. That's really wonderful to hear. Thank you so much for sharing this with our audience. I'm really excited for them to learn more about all of the different options that Two Chairs is offering. It makes a lot of sense, the hybrid approach, because it just feeds into what I understand your overall mission to be in supporting the client in how they want to be seen, as well as the provider. So it really makes a lot of sense. As always, Alex, I'm running out of time too quickly. If I could ask you one last question, how could our listeners support the work that you're doing and get more involved with Two Chairs?
Yeah, it's a great question. I think what I would say to folks participating in the conference is I think everyone here is on the same page about clients and the mental health care system. Our mental health care system is not doing nearly a good enough job at serving clients, providing access to care. I think the therapist side of the equation is just not getting talked about enough. And clearly from the last 25 minutes, this is an area I'm incredibly passionate about. And it comes from, spending the last 5 years of my life with therapists and hearing now countless stories about how challenging this field is, how challenging this system is. Therapists are not sufficiently supported in their work, and that's what's driving the burnout epidemic in this field. And so I think what I would invite folks listening, folks across the conference, to think about is how do we build a better mental health care system, not only for clients, but also for therapists, and move away from thinking of networks of therapists as commodities, slots to be filled by the next client up. They're not commodities. This is an incredibly personalized service. There are so many different versions of it, so many different theoretical orientations, so many different therapeutic interventions, so many different styles in the room. We've got to value and honor those different perspectives. It's certainly something we've incorporated into how we approach our work, and would invite others in the field and the industry to do something similar. Absolutely.
Yes. Providers are at the heart of providing care to so many individuals who are struggling right now. How can we not support them the best way we can? So couldn't agree more with everything that you've said. Thanks so much, Alex, for your time. Really excited about the work that you're doing and your entire team is doing. Always a pleasure.
Great. Thank you so much. Appreciate it.